So we're trying to actually look at some pregnancy complications. That's like we're looking at different ways in which babies can present. Then we're also looking like at complications that maybe sometimes if a baby doesn't present with the head, then you might want to opt in for cesarean section. Then we're also saying that sometimes if a baby presents with the head and even if the cervix is not dilated, the baby can move in. All right, so one way of trying to know how much your cervix is dilated is what is known as a Bishop's curve. All right, so this is just a Bishop's curve. I'm trying to look at the cervical effacement. That's how dilated, how thin. Okay, as a cervix, initially it is what? Thick. Later on it start becoming thin. All right, because the thinness helps it to dilate more. Do you understand? So it's interconnected. All right, so this is just what the Bishop's curve is. All right, so it's just a clinical tool. It's used to what? Assess how ready the cervix is to accept the baby. All right, and this will also help you to now predict that, okay, is this woman ready? Can this woman deliver through the vagina, or we have to actually go in for cesarean section? Do you understand? So it's just a tool that will help you access and make preparations before time. So this is just it. All right, this is a better picture which you can pause to observe the writings in each of the stages. All right, I just cycled here. From there you should just know. All right, the cervix is earlier on thicker, later on start becoming thinner. That's what makes it to dilate more. All right, so factors like, what are you trying to look out for if you are doing a Bishop's curve? The dilation. All right, so how open is the cervix? All right, between 0 centimeters to 5 centimeters. Okay, how open? Effacement, how thin is it becoming? Of course, you can't have a thick cervix and it's dilated. Only thin cervix can dilate more. Do you understand? So it's just like that. So station, you're also trying to look at what? Position of the baby's head relative to the pelvis. Okay, so the likelihood of the baby coming down with the head. Consistency, you are looking at the cervical texture. Position, cervical orientation, is it properly positioned and all of that. Right, so I think the main thing you are looking at, or the dilation, is it ready to accept the baby? So interpretations, basically all these things you are scoring it all. Do you understand? Like each of these factors, all right, you rate it between what? 0 points or 2 points or 3 points. Do you understand? We have how many factors here? We have about 1, 2, 3, 4, 5. So 5 factors. After you finish rating the woman, all right, if you get anything more than 8, okay, she's ready for vaginal delivery. If you get anything less than 5, it's likely. Then anything between 6 to 7, all right, is okay, less than 5 is unlikely. Like she won't, so she will likely not give birth. Right, then 6 to 7 is borderline. All right, so your doctor will basically help to now know what next. So it helps to make decisions about if a woman is ready to give birth through the vagina. Right, so use alongside assessment like ultrasound. So it's not the final say. Do you understand? You use it alongside other measures too that can help you know if a woman is ready to deliver through the vagina.